Rep. Natalie Price here with an update. The Trump administration has now officially announced new CMS rules that directly target hospitals providing medically necessary, science-backed care to trans and non-binary young people. These rules make one thing clear. Donald Trump is using the power of the federal government to wage a culture war inside our hospitals. Under these rules, hospitals are being put in an impossible position: provide medically necessary care and risk losing Medicare and Medicaid funding, or abandon patients who depend on them. This attack on trans youth is also an attack on doctors, nurses, and the patient-provider relationship that every one of us relies on. And it's happening in the middle of a public health and economic crisis that Trump and congressional Republicans have created. Premiums are doubling, families are struggling to afford care, hospitals are already under strain. Congressional Republicans could be addressing those failures. They could be lowering costs. They could be stopping insurance companies from gouging patients. They could be fixing the damage from their disastrous trillion-dollar corporate tax cuts. But instead, they're doing this. This rule, it doesn't make healthcare safer or more affordable. It makes it more political, more dangerous, and more cruel. If they can insert the federal government into care for trans youth, they can and will do it to anyone. If we don't stand up now, this will not be the last time that Trump uses healthcare as a weapon. Healthcare decisions belong to patients and providers, not politicians chasing culture war headlines. So what can we do? Stay tuned for a link to CMS portal for public comment. It should open tomorrow, and then we'll have 60 days to make our voices heard. Let's speak up in support of trans patients and all patients who deserve access to care.